That's who it was.
Hi guys!
I was like, what
Thank
is
you for
this?
joining me again for another night. So, as you know, I went to work today and everything was pretty much normal. Surprised me too. But my coworkers did notice that I was a little more dewy looking. So I told them that's probably because I'm super hydrated. I'm drinking 2.5 of these a day, okay? I have to because of chemo to keep hydrated. So basically that kind of equivalent is an equivalent of 4 bottles of 16 ounces of water a day. Let me talk to you more about how I was diagnosed with cancer. If you guys read my story, I know a lot of you guys have poured in so much support on the GoFundMe, and I truly appreciate it. But what happened was I was diagnosed in June, mid-June maybe, and then got everything done in such a short amount of time that I had no time to even breathe or even think about anything else. Got my breast checked, got sent to mammogram, got an ultrasound of my breast, and then got a biopsy. All that was done within like maybe less than 2 weeks, and then I got my prognosis back. Um, so diagnosed with stage 2 invasive ductal carcinoma. Good thing that my PCP has a oncologist friend who she referred me to, and I was put in right away. So right now, my oncologist name is Dr. Kathy Sam, and my PCP's name is Dr. Doom, who is wonderful, by the way. So I have 2 types of treatment that is going to be happening to me. First, we're going to try to treat it with systemic treatment, which is the chemo medicine, all of the medicine that's going to be attacking the cancer cell directly, hopefully, because of my prognosis. And then we'll move towards local treatments where, surgical oncologists will be asked to assess my breast mass and see if we could do either a partial mastectomy or we might have to do a full mastectomy. And then after that, it'll be radiation to make sure that all the cancer cell is cured from my body. Let's see. So about my cancer, like I said, stage 2. The staging is determined by the size, if it's and lymph nodes is involved, or if it's metastatic. Let me see, what's the word? Metastasis. Okay, meaning it has a spread. Good thing that my tumor size, even though it's a little bit on the bigger size, 3.6 centimeters, still not as big as 5 centimeters and up, so which is still good. No lymph node involved and no metastasis, which is why it's a stage 2A. ER negative, PR negative, and then HER2 positive. There was a slight mention that I was ER positive for like 4%, but I completely agree with my oncologist when she told me that if there's 96% of something negative in your body, then there's no point in classifying it as a positive thing, right? So, but it's a good thing that it is a HER2 positive, because there's a lot more research and medications out there to attack this cancer directly, which is good. And then my aggressiveness for the cancer was actually grade 3, which is the most aggressive one. It's unfortunate, but it's not unbeatable, So first, we'll do systemic treatment, then local treatments. But before that, before I even started my whole chemo process, I had to get clearance from a cardiologist because of my whole AFib scare before. Got clear, so I'm good now. And then I was sent to a fertility specialist and got my eggs preserved. All of this was done in like 2 weeks, which is kind of quick. So it was a good thing that my body was cooperative with me, and I was able to retrieve a good amount of eggs and freeze about 16 of the mature size of eggs. Now, for those of you who don't know or is not familiar with the process, it's basically IVF. So for a good 2 weeks, I had to check myself in the morning and in the nighttime with medications around my belly, and to stimulate the growth of my follicles. And then on the day of retrieval, of course, I would put under, but breathing on my own in anesthesia, and then that's what they retrieve the eggs. I'm glad that we were able to freeze 16 eggs, so that's actually a pretty good amount, and I'm happy. So I have my oncologist to thank for that, because I didn't even think about freezing my eggs. It's just not something that comes to my mind when I was diagnosed with breast cancer. So basically during my chemo session, I'll be taking in 4 types of drugs. It's called carboplatin, taxotere, and then the other 2, Herceptin and Perjeta. Those 2 are the medicine that's gonna be hopefully attacking the HER2 cancer cell directly. But as you guys saw, before I even started my chemo session, I had already had complications with lung fluids in my lung. Glad that that's taken care of though. I'm getting cough here and there, but I'm gonna survive, and I'm okay. And I had my chemo session yesterday, Monday, and I went back for the Neulasta shot today. The Neulasta shot is basically a shot to help me boost up my white blood cell, because all the chemo is gonna basically kill off all the cells in my body. So that's basically essentially what it means. So fighting a good fight. I'm holding on. Do I feel any different? Today I went to work like it was normal, and my friends even told me that I look dewy, like I told you guys. But however, I think towards the end of the night when I was eating, things did started to taste a little bit more different, a little bit more bland. And then I did have I'm having it right now actually, a little bit of nausea, and I took medicine for it. So hopefully the medicine will kick me soon. But I have my wonderful coworkers got it for me. Me too, love you. She got this for me just in case I need a barf or anything like that. I need to bring it anywhere. And sniffing thing, So, and I think it's gonna be so helpful. Thank you, I appreciate it. So what I have to prepare after the Neulasta shot is I need to have a leaf, as well as Imodium, because of the Perjeta, to help me, stop any diarrhea, or a leaf to stop the pain that I will most likely be experiencing tomorrow. Bone pain, growing pains, prickling pain around your whole body. So I don't know if I'm going to experience it, but my nurse recommended to have preparation just in case I will. So far so good, nothing too crazy. I was informed to expect to be hit by a truck in a couple of days after chemo. So I'm just it's not something I look forward to, but something that I'm expecting, and I'm bracing for it, and I'm preparing with every medicine that I have. I have like 3 nausea medicine that I was prescribed, so I have that ready. And then I bought myself a little some treat, a little something, because I love chocolate and I love peanut butter. So it says family size, but I don't know if I want to share. Okay. Oh, I'm gonna turn in for the night because I don't know what else to tell you guys. Thank you, other than thank you for your support and the love and care that you guys poured in. I know that I'm not very emotional right now, but I have my moments, and I have my moments. Thank you guys so much. Okay, I really truly appreciate it from the bottom of my heart. Thanks. Have a good night. I'll update you guys more as things happen. And right now, I don't have any signs of hair falling out yet. But when I do, the first sign of it, I will be shaving my head. So, and I'll film it. Alright, thanks for watching, guys. Good night.